So in this session, we are going to see about the neurological assessment, which will be done for a patient who is having any sort of central nervous system disorders. So coming to the neurological assessment, it is the total assessment, or you call it as total checking of all the sensory neuron as well as the motor responses, and along with the reflexes to determine whether the patient is having any sort of central nervous system impairment. So here this may be indicated for a patient who is having a sort of neurological disorder, or to also screen the early symptom of any sort of neurological disorders. So before starting the assessment, we have to go in for the patient history. So when you are collecting the patient history, the time of onset, the duration and the association of symptoms is being collected. We will be collecting the age, gender, occupation of the patient, whether the patient is left-handed or right-handed dominance. And of course, we will be collecting about the comorbid conditions along with the patient, which is the past medical history. And we also collect the detailed history of the drug, whether he or she is consuming. And we also collect the family medical history relevant to central nervous system problems, and social history, whether he or she is been consuming alcohol or cocaine usage or sort of any cigarette smoking and so on. In the neurological examination, we will be skimming and scanning through the level of consciousness, mental status examination, cranial nerve function, motor function, sensory function, cerebellar function and reflexes. So in this video, we will be covering about the level of consciousness, mental status examination alone, and cranial nerve function and motor function will be seen in the next video. So when you want to coin the level of consciousness for a patient, if the patient is fully awake and responding to a verbal stimuli, then the patient is fully alert. If he or she is drowsy and is not able to arouse easily, then the patient is said to be lethargic. If the patient is still not able to arouse with your great difficulty, then the patient is said to be in stuporous condition. If he or she is totally not responding to verbal stimuli but with some sort of painful stimuli, little motor function is being established, then patient is said to be semi-comatose. In case if the patient is fully coma, then there is no verbal response as well as there is no response to painful stimuli. When you assess the mental status examination, we will be checking the alertness and orientation. So we will be coining if the patient is fully opening the eyes, conversating to us properly, obeying the commands properly, then the patient will be getting full alertness. As well as to check the orientation, we will be checking the patient whether oriented to person, place and time. In concentration assessment, we will be asking the patient to tell a few months in the month of order of forward as well as backward, and ask the patient to mentally subtract 7 from hundreds, and like for example 100 minus 7, 93, and 93 minus 7. So like that it goes on in the sequence pattern. To check the memory, we will be assessing the long-term and short-term memory. To assess the long-term memory, we will be asking about whether the patient went to high school. And to assess the short-term memory, we will be giving the patient to recall 3 objects. After several minutes, the same objects is being repeated by the patient. If the patient is able to coin the 3 objects, like for example, you show apple, pen and writing pad, and if the patient is able to say, then we call it as short-term memory is said to be intact. To assess the language, we are going to ask the patient to repeat a complex sentence, like for example, today is a lovely day. And if the patient is able to repeat the same word, with that, the language of the patient is also said to be intact. But while testing the language, see that you are speaking to the patient's own language. For example, if he or she speaks only Hindi, then you have to speak the sentence in Hindi and then tell the patient to repeat the same. So the other important parameter which will be checking in the central nervous system is that we will be analyzing the Glasgow Coma Scale. So to analyze the Glasgow Coma Scale, we will be giving the scoring rates of 1 to 4 for IEO response, and for verbal response 1 to 5, and for motor response 1 to 6. Here the least possible score will be 1 and the most possible good score will be 4 when the eyes are spontaneously opening and when the eyes are opening to noise. Like for example, you go to the patient and only after calling out his name loudly, Mr. X, like that you loudly call and then the patient is opening, then the score is getting around 3 for the patient. And if the patient is able to open the eyes to pain might be you give a painful stimuli with a blunt object, then if the patient is responding, then the patient will be getting a score of 2. In case to assess the verbal response, so you are going near the patient, there is no verbal response, then its patient will be having a score of 1. Incomprehensible sound or speech which is not able to, you cannot distinguish what he is trying to say, it is all obscure, then the patient is getting a score of 2. And if it is very much inappropriate or might be comprehensible words, then the patient will be getting a score of 3. And if still the patient is said to be confused, not able to give out the respond to the question what you have spoken, then the patient will be getting a score of 4. And if the patient is totally able to respond in a normal vocal response, like for example you ask what you had in the morning for breakfast, and if the patient says yes, I had 2 chapatis with sabji, then yes, it's a patient is getting a score of 5. To motor response, we will be assessing the patient just by checking out. So here you just go and give some commands. Please flex your extremity, upper extremity, right, left, lower extremity, flex your lower extremity, right, left. And if the patient obeys to commands, then the patient will be getting a score of 6. If the patient is not obeying the commands but due to giving after a painful stimuli, if he is able to localize the pain, then the patient will get a score of 5. After giving the painful stimuli, if the patient is drawing away the hand or the limbs away from the painful stimuli, then the patient will be getting a score of 4. Even after giving so much of painful stimuli, still the patient is showing a spastic flexion, abnormal posture, that is T-corticate posture, score will be 3. T-cerebrate posture, the patient will be having abnormal extension of the extremities, which the patient will be getting a score of 2. No response to pain, then patient will be having a response 1. So in case of a decorticate position, the upper picture shows there will be pointed toes towards the foot end, and you can see the upper extremities are well flexed and towards the midline. In case of a decerebrate position, the same thing, the legs are extended and rigid, but the upper extremity you can see it is towards the sides of the body with curled fashion, that is abnormal flexion.